So the core function of public health has core functions, and every professional in public health, in order to be considered like a public health agency, in order to do good public health work, follows these core functions. And the first core function is assessment. And so we have assessment, policy development, and assurance. And so when we think about it, assessment is all about trying to understand what is the problem. The very first thing when you go into a community is and they're coming to you with an issue, you have to define the problem, because if you don't define the problem, then you can't find solution. So the very first thing is to define the problem. We have to find out what is the need. So during the assessment phase, might be collecting data, might be interviewing people, which is also a form of collecting data, right? And try to find out what exactly is the problem. You also might be identifying what are the risks, what are the protective factors. So when we develop a solution, then we are able to include those things in the solution. And one of the most important things to understand about the assessment piece is you want to engage the stakeholders, those who are invested in the community's success, those who want to see the community thrive. You really want to engage the stakeholders. And the most important stakeholder when it comes to the assessment piece is the community member. And you might ask, why is the community member so important? Well, they're the ones who are, one, impacted. They're also the ones who know what they need the most. Some people just assume that a certain community would need something and they don't consult with the community members. You cannot do that. You have to include the community members in every discussion. They're the most important people at the table. The next one is policy development, and this one's a little confusing because when you hear policy development, you think that it's just talking about policies. But in actuality, what it is talking about is developing prevention and intervention strategies, which policy is a part of the prevention and intervention strategy. For example, primordial prevention, right? There's primordial prevention, primary prevention, secondary prevention, tertiary prevention, and quaternary prevention. Policy development is one form of one form of prevention strategies that public health people can utilize, right? And that's the primordial one, where you look at rules, laws, regulations, and policies in order to prevent something from happening, before something ever even starts. We're looking at creating laws so that people don't even have an option to do it, right? So, for example, secondhand smoke is a huge issue. And so before, people used to be able to smoke everywhere. And so when we look at primordial prevention, aka creating rules, laws, regulations, and policies, we are able to stop people from being able to smoke in communal spaces like apartment buildings, townhouses, duplexes, restaurants, bars, parks, places where people congregate together publicly. We are able to create rules, laws, regulation, and policies to impact those places. So yes, policy development is a part of prevention strategy, but that's not all we do here, right? This is really, really in the policy development piece. This is where we are creating those prevention and intervention strategies in this process. And part of that is policy development, but that's not it. That's not all we do here. So policy development is a little misleading, but that's what they call it. So this is one of the core functions, is policy development. And policy development builds off of the assessment, right? Because assessment is where we find all the evidence. That's where we collect all the evidence. And so based on that, we find solution in the policy development piece, in the policy development phase. And so when we talk about evidence-based practices, us developing our prevention and intervention strategies came from the assessment piece. And when we talk about art and science of public health, the assessments piece is the science piece. That's where we're collecting the data. That's where the science happens. And then the policy development piece is the art piece. This is where we create the solution piece. And then the final one is assurance. And it's really important that as public health professionals that we aren't just going into communities and setting up shop, helping them, and then we just walk away and be like, all right, deuces. No, you can't do that. because how do we know what we tried or what we implemented is actually works, right? And so the important things to understand that when we do something, we need to evaluate it and making sure and ensure the people that it works. Ensure that it's getting those outcomes that we said and we think that it's supposed to be doing. And so this is where we continue doing the evaluations. We continue to tweak the program if need be, or it's a solution if need be, in order to make sure that we are getting those health outcomes that we are trying to achieve through the solutions that we created, right? This is really ensuring the people are safe, right? So when we look at what assurance is, we're looking at the environment, educational practices, as well as the basic medical services, ensuring that people have access to these spaces as well. So just a recap, when we look at it, we have the assessment piece, where this is where we collect the data. The most important person at the table in the assessments piece is a community member, because they're the ones who are impacted. They're the ones who know what they need. The next piece is, after we get all that science, after we get all that evidence, we now try to develop solutions. And one of the things to understand about solutions and the policy development piece is that just because something worked in one community does not mean it's going to work in this community. I don't care how similar the communities are. We are not a monolith people, right? Just because someone has the same color skin, just because they have the same sex, just because they have the same sexual orientations, whatever, that does not mean that it's going to work also over here. Now, it might work, right? Those might be indicators that it's a potential that it works, but we can't for sure say it's going to work. So we need to go ahead, and what we do is what's called pilot testing. Try it on some people, like a small group, and then we try it on everybody to make sure, because also we don't want to waste resources. So that's the policy development piece. Prevention, intervention. This is the art of public health here, taking all that science and relating it to the people. And then assurance piece, like I said, we need to make sure that our communities that we serve and the solutions that we provide are sustainable for that community, that they actually are working. The worst thing to do is to put something through and it not work. Like, oh, look, it works. Everything's going great. And then you walk away. It's almost like you're trying to fix a leak in a pipe. You turn the water on just a little bit and nothing happens. And then you're like, oh, this works fine. And then you continue to use the faucet even more, and you turn on full force. And now all of a sudden, there's all this leak in the piping, right? We need to make sure that we are testing it and making sure we're continuing to checking it and making sure there's no leaks, making sure that the people are able to take care of themselves, because we do not provide solution to the people for them forever to rely on us. We provide solution to the people so that they can be sustainable on their own, self-sufficient. So in addition to the core functions of public health, we also have what are the essential services of public health, which further define the core functions of public health. So the essential services, there's 10 of them, is monitoring health status to identify community health problems, right? To diagnose and investigate health problems and health hazards in their community or in the community. That's all in this assessment piece. The policy development piece is inform, educate, and empower people about health issues, mobilize community partnerships to identify and solve health problems, develop policies and plan that support individual and community health efforts. And then also insurance is enforcing laws and regulations that protect health and ensure safety, link people to the needed personal healthcare workforce, assure a competent public health and personal healthcare workforce, evaluate effectiveness, accessibility, and quality of personal and population-based health services. That's the assurance piece. And at every single level of the core functions, we always need to research for new insights and innovation to health problems. You got to remember, just because you saw a problem over there or a solution over there does not mean it's going to work in this community. So we always have to be ready to innovate, i.e., make something new, create a new solution to the problem. So this is a further breakdown of the core functions of public health. And so when we look at it, how exactly do those essential services apply to the CHW? And so when we're looking at the monitoring community health needs, that's like conducting home health visits, surveys, and focus groups. Community health workers can do that. Also looking at diagnose and investigate health problems. So report community concerns to public health agencies. Inform, educate, and empower people. That's leading workshops, health fairs, and outreach programs. Mobilize community partners. Organize coalitions. Partner with local leaders. Develop policies to support health. That's advocating for community-centered policies. Enforce health regulations, so really educating communities on laws and rights. Link people to healthcare services. Assist with referral, transportation, and insurance enrollment. Ensure a competent workforce that provide training and mentorship for new CHWs, evaluate and improve programs that collect feedback on community-based interventions, and then serving all functions is that research for new insights and solutions or being innovative, and this is participate in community-based participatory research. So you see CHWs do fulfill the essential public health services. They also fulfill the core functions of public health. So as you see, CHWs are a specialized public health professional.